certain that there is no immediate cause for panic. That's it. That's why we have on this show this morning if there is any cause for panic, really, or if we need to take some precautionary measures over the fresh COVID cases. We're joined by the acting state epidemiologist, yes, Dr. Said Akimbowale. Good morning and thank you so much for joining us.
Good morning and good morning to our listeners.
Okay, I remember when COVID, let me say when COVID first came, or let's say COVID-19, because there are other COVIDs, as it were. So there were fears, especially with the number of casualties that ended up with that. Nose covering, washing hands, use of sanitizers, and everyone began to be hygienic one way or the other. Everyone began to take cautions. Okay, I don't want this to come near me. Suddenly, we threw cautions to the wind. Everyone went back to the normal thing. With this isolated case that was observed in Cross River State, is there a cause for panic?
Well, the summary answer is no. There's no cause for panic. The reason for that is just because most times when people panic or when the masses panic is because of lack of information or inadequate information. So it is a normal process for people to be afraid for their life. It's part of survival instinct for everyone to be afraid for anything that could, jeopardize your health or your life or your livelihood. So panic is like a normal process. That is when there's no adequate or good information. However, this is 2026. When COVID came in 2019, it was new. So that may account for the panic. Even in the medical field, we don't know much about the virus. We don't know much about how it behaves, how it can be treated, and all those. So that accounted for the panic that was experienced then. But in this 2026, we've lived with COVID for many years. We've learned a lot about it. We understand the dynamics. We understand what it can do and what it can't. And in fact, we've had a lot of interventions done over the years to mitigate the impact, even if we have future outbreaks. So based on that, there's no need for anybody to panic. Disease is a natural process. It has been happening since time immemorial. And luckily for us, this is 2026, where epidemiology, public health, medicine has advanced to a certain level whereby we can easily identify how to prevent and how to control diseases. So far, the public and everybody cooperate with us in the public health space. They listen to information from the right sources and they abide by guidance from authentic sources. So there's no need for anybody to panic.
All right, with that isolated case and that discovery or that scenario that played out, would you now say that we are always at alert in Nigeria? We are not losing guard. We are not throwing cautions to the wind. And then Nigeria is actually safe. The gatekeeping is safe health-wise.
Well, I can tell you that, there's no, since we are not God, we cannot say with 100% certainty, but with reasonable certainty, I can tell you that our level of preparedness and our ability to respond and mitigate all these things has improved multiple-fold pre-COVID era. Because COVID itself, one of the good legacies it left behind is that it helped us strengthen our health system across the country and worldwide. So it's one of the legacy, positive legacy COVID-19 left behind. A lot of reform has happened regarding Nigeria's health system, the whole landscape across, not just in disease surveillance, not just in management, we learned a lot of lessons. Because COVID-19 showed us a lot of gaps in the system, both in Nigeria and outside the country, worldwide. So based on those gaps, all the intervention and most of the interventions that have been done since then have been done to address those gaps. So we are better off today than what we were pre-COVID-19. So I can tell you that our level of preparedness, not just in Ogun State, but across Nigeria, has far improved than what it used to be.
It seems we have almost forgot what COVID-19 is until we had that report from Cross River. And you mentioned that we are living with COVID-19. Is COVID-19 outrightly not longer in the world, or we are still living with COVID-19?
COVID-19 never left. I would say that. it never left. The prevalence or the occurrence reduced to barest minimum, but there are still pockets of cases across different areas around the world. So as long as COVID-19 has not been eliminated as a disease or eradicated as a disease, we should always expect it at any point in time. And as you know, as long as the virus still exists, because we have not eradicated or eliminated the virus, there's tendency that it will still mutate and start showing us new characteristics or new traits. So those possibilities are there, and the surveillance system is aware of those possibilities, and that's why we've never lost guard. Because if Cross River has lost guard, they won't pick the case. They picked it because there's a surveillance system in place, and they were able to respond because there's a response framework in place. So that still comes back to what we are saying, that our level of preparedness, ability to respond not just to COVID-19, to many diseases, has far improved than what it used to be. And that's the exact reason why there's no need for anybody to panic when you hear about a disease. Now, even the announcement that we detected COVID-19 is an improvement to what it used to be. Because now, it shows that we're in the health system, in the surveillance system in Nigeria, we are more transparent about information. So the fact that Cross River is announcing that, oh, we pick a confirmed case in our territory, it is not to create panic. It is also to alert. It is a form of alert to others to watch out. I've seen this, be on the guard. It's just like a security system. If an estate said, oh, they are robbing in my estate too, it's to alert others to be on the watch. It is not to create panic in other estate to say everybody. It's just to let you know, this has happened here. Be cautious and watch out. Just like in traffic, you do radio messages in the morning. Oh, there's traffic along this route. It's for people to plan and prepare. So the fact that Cross River announced that, oh, we have confirmed one case of COVID-19 is part of their obligation to alert other states, to alert the public to be cautious, to, okay, don't lose guard, be more careful, this is with us. So it's part of an improvement in our response system. So it's actually not to create panic or just to make people be afraid.
Okay, that case in Cross River State, which was confirmed, for the isolation of that man, is said to be a Chinese national. And I say again, Chinese national. You will agree with me that the COVID-19 outbreak in Wuhan, a city in China, is still ongoing. So would you now say that that was very easy for them in Cross River because the man was a Chinese national?
Not necessarily.
Okay.
Not necessarily. Though it may increase in the index of suspicion. We call it index of suspicion. There are some key red flags you look for that, just in medical field, if you have some reasonable risk factor, like travel history is a risk factor, it may increase index of suspicion, but it doesn't necessarily mean that the surveillance wouldn't have picked it if it was somebody else.
All right, the use of protective materials, say nose masks and all, someone is feeling unwell, is coughing and all, but because it's not a COVID era, so to say, because we are not really in the pandemic as it were, if you cough or we have jettisoned the use of the nose mask. Would you advise, as a medical practitioner, would you advise the continuous use of these materials when we feel unwell? Say the sanitizer is there, they seem to, in some places they seem to have gone into oblivion. The hand washing techniques and hand washing habits seem to have gone. They seem to have gone. We don't really observe them, because I remember that COVID time. It was compulsory though, and every establishment, even homes, have a hand washing area. So we don't seem to have them. Would you advise that we say have the nose masks when we feel all those symptoms and all, or we should just continue to live our normal life?
Well, I will answer the question in two phases, because that word normal life, it's very important. I will start with the word normal life before I go to the issue of face mask.
And add the new normal.
Actually, normal life should be, and hand washing should be part of normal life. It should not just be when there is a disease outbreak. So that's why we need to redefine what normal life is. It is basic hygiene. It is not just for COVID-19.
Great.
You can prevent cholera with hand washing.
Great.
You can prevent a lot of diseases with hand washing.
Great.
Our children are susceptible to all sorts of diseases. So by just washing your hand, it should be a routine. It's a normal thing we should encourage our people to do day to day, not just as a result of a response to a disease. So as part of normal life, yes, I would say we should continue with our normal life. But the normal life include washing of your hand, include staying in a ventilated room. It is not normal for you to stay in a overcrowded area where it's not ventilated. It's not normal. So it seems that word normal is what we should define, because these are things you do to prevent COVID-19 and other respiratory diseases or diseases that are transmitted through either airborne or air droplets. Overcrowding is a risk factor. Overcrowding is not part of normal life. Even in a vehicle, in a room, in housing code, there are standards that are recommended number of people that should stay in a room. So this is normal life. So what is actually happening is that we are living something different from the normal life that we are calling the normal, which is
calling the abnormal normal.
Exactly. So staying in overcrowded area, not doing your hand hygiene as you should. Even cough etiquette is basic thing. It's a normal life. You should not be in a crowd and just cough into the air. There's a cough etiquette that you use your elbow to cover your mouth. You understand? So these are normal life. So what we should emphasize is encouraging our people to live the normal life by protecting themselves, by using these basic precautions every day. So I will go back to the issue of face mask. Face mask is not part of normal life. So at this point, it is not an additional recommendation. But for individuals who wish to, and people can use at their own discretion. But we have not gotten to a stage whereby people will be mandated to use face mask. So anybody who wish to use face mask at this point is out of their discretion. Because face mask is not the first line of defense. In any form of personal protective equipment, PPE is usually the last form of defense. And the first form of defense is people following guidelines, procedures, just like hand washing, cough etiquette. Somebody who has coughed into his elbow, the palm, when he's shaking somebody, is not likely to transmit that disease. We shake ourselves every moment. So these are the first line of defense we need to put in place before we put face mask. The fact that you are wearing face mask, you cough into your elbow, or you don't even know how to dispose the face mask, you touch the inside of the face mask while disposing, you shake your children, you have transmitted the disease, and the face mask has not helped. So that's why we are emphasizing that the normal hygiene, personal hygiene, normal etiquette, like handle of doors. Somebody who has sneezed into his hand and is holding a door. Look at this door. Everybody will open this door and pass through. So the routine wiping of handles, formats, things people come in contact with should be, cleaned or disinfected from moment to moment. The use of hand sanitizers where water is not available, because even hand sanitizer is not the first line of defense. Hand sanitizer is an alternative to hand washing when hand washing is not feasible. The first line and the recommended one is still to wash your hand with soap and water when feasible.
I remember the COVID time, there were different shapes and sizes, different volumes, different content of sanitizers. Some will be smelling like a rotten egg and all. So, I was going to come to that. The sanitizer, of course, you just mentioned it, that when water is not available, you just use that and all. But if we have to continuously have sanitizers around, which would you recommend? How would you recommend it? Because I can't remember the last time I saw one.
Well, just as I've said, the primary method that is recommended for hand cleaning or hand hygiene is hand washing.
Water, yeah.
Not sanitizer. But because we know that it is not feasible to carry water around or see water, running water and all these things, that is why hand sanitizer is an alternative.
And it comes handy. You can carry
exactly around where, like, you just open the door and do, you can't just rush to the toilet. You do that as an immediate remedial process. But as soon as feasible, you are still expected to still wash that hand. So regarding that, the primary recommendation, which will be hand sanitizer. And considering economic situation and many other things, hand sanitizer does not come free. You will have to buy. So considering economic reasons, And that's why we recommend that even workplaces, public places, their hand washing cubicle or facility where people randomly can just go. You want to enter your gate, I can just wash my hand, or after leaving these premises I can just wash my hand outside, is to limit the cost and the burden on people.
But people have complained about availability of water. Some even say that they don't even have running water. Not even because in this part of the world these amenities, we make them available for ourselves. Public water not available, we buy this water, and the companies that you go to, the establishments that you go to, they complain. Even in their toilets, you don't have enough water. So having water to, in their own word, waste to wash, and what would you say to this set of people?
Well, I will say it's a matter of prioritization and what you perceive to be important to you. We believe we've all drank water today, and if you haven't, we'll still drink water today. So if you can find water to drink, it's because you see it as important to you. Then if you perceive hand washing as important, the same way you can make water available for drinking, you can make water available for bathing, you can make water available for washing your clothes. Of course, many people, at least most reasonable people, do not walk around naked. You do not walk around with dirty clothes. You find water to get these things done. So how many meals will you use to wash your hands? So that is not really an excuse for not washing hands. It's just a matter of perception, how important you perceive this activity. The previous activities I've listed earlier were perceived to be important. So even if you have to walk kilometers or do whatever it takes to get the water available to get it done. So if we perceive hand washing as part of what is important to protect our own health, to protect our neighbor, because you are not just protecting yourself. If you do not wash your hand, you bring the infection into your family.
Exactly.
You bring it to your children, you bring it to your neighbor. If you're a teacher, you take it to the classroom. If a student hands is infected or has a contaminant, we bring the contaminants into the classroom. So if we see it from that angle, that you are not just protecting yourself, we are protecting your immediate cycle, every area you attend, then we will find a way to get it. And I'm not sure water is scarce. It's an essential commodity. There's no household in Ogun State or in Nigeria that does not have a source of water.
Okay.
They may have challenges or have one or two things, but they use water in every household in Ogun State. So it's just a matter of perception.
Source of water, wherever it comes from, either from the public water or the one you make privately,
or your own private borehole.
Because some people may come after you that okay, maybe the public water is not really available.
Well, regarding availability of water, it is not for me to talk about in the public health space.
It's not, but so, it's part of what we need.
Yes, it is, which I acknowledge. And I acknowledge that the citizens of Ogun State, the citizens of Nigeria, and the government itself, it is not a one-man show. The citizens have done their part, the government is doing their part, and everybody. So it's a collaborative effort. But the most important thing is the end goal, availability of that water for use, which as of today, nobody has died because I don't have water to drink. This water is available. We may still have one or two challenges, but these are not things that are not insurmountable.
The message is clear. We should not lose guard.
Yes.
And now let's come down to Ogun State. What's the case and trend when it comes to COVID-19 in Ogun State?
Well, I can tell you that this year we have seen suspected cases, and we have tested all of them, but none of them have returned positive. So I can tell you that for this year in Ogun State, we have not confirmed any COVID-19 in Ogun State. But I need to mention the aspect of suspected cases, because suspected cases is an indication that your surveillance system is working. If you do not suspect to test, you cannot confirm. So we are seeing suspected cases, and we are picking them, we are testing them, but I can tell you as of today, we've not confirmed any. But we are still on the lookout. If you find any,
how prepared are you compared to the past in terms of isolation, testing, and response rates?
Well, as I've said, in Ogun State and in Nigeria as a whole, we have moved away from response to an individual disease to a comprehensive response strategy. So there's a comprehensive response strategy. Whatever the disease is, the mechanism is on ground. It's the same mechanism that will be activated, but peculiarities to that disease will now be brought in. So it makes that flexibility, that robustness, that coordination is there. So regarding testing, yes, we have laboratories in Ogun State. COVID-19 has evolved beyond reference laboratory alone. There are RDT kits, rapid test kits. So it's part of the advancement that has been made. So Ogun State has the capacity to conduct RDT, rapid testing. Ogun State have the capacity, which we still have during COVID-19, about sequencing and other things. We have all those capacity. But as of today, because of the coordinated structure we operate in Nigeria, there are what we call reference laboratories, which is coordinated by national NCDC, Nigeria Center for Disease Control itself. So one of the reference laboratories in Lagos. So when we need to log cases into the national system, if for us to confirm a case in Ogun State now, it's not for us to say, okay, we have seen the case. Yes, we have confirmed it. We need to deposit the evidence into the National Archive, and so we can send samples to the National Reference Laboratory, which is in Lagos. So all those mechanisms are in place, both to collect the sample, to move the samples, and we have that. And regarding isolation, yes, we have designated isolation centers. But because the use of those centers is not, during COVID-19, the demand is higher than now. So what we have as a state, or what we do as part of a response framework, is to have some designated isolation center that will be untouched. Either we have emergency or not, untouched.
And they're still
yes, they are operational, they are functional. They can be activated in minutes, not a matter of hours. It's there. But we have them in reduced number. Why? Because the waste of resources designating places as isolation are not used, maintenance and other things.
And when there's need for
exactly. So what we do is we have a small number that is designated that for the first form of response, you will not have to think where are we going. We have those ones available. Then we have another one that is designated but used for other purposes. Meaning that if the ones that we designate unused get overflowed by chance, or by we don't pray for it, but it happens. We didn't pray for COVID-19, but it happened. Where we need to isolate more people. Those centers that are presently in use, we have them designated, listed, personnel trained, can easily be converted into isolation center. So it's part of our response preparedness plan that's available in the state. So regarding treatment, isolations, those mechanisms are in place. As of today, we have a case manager for all infectious disease. So as soon as you have a case, we don't have to look for who we manage. We already have that mechanism, and we meet frequently to what is the situation. So if it is not COVID-19 today, if we by chance find cholera, yes, the same mechanism will be used, but with one or two adjustments. So that system is in place in Ogun State.
Okay. When you look at the symptoms of COVID-19, because this is like a form of education, we have had the scare, and everyone seems to be on top of their game. And look at the symptoms of COVID: a fever, a cough, and some are even similar to the common cold. Someone wants to know, okay, what do I do when I have this? Should I just treat them as the normal, the fever that I have, or anytime I have these symptoms, I just see the medical person immediately, or just treat them normally?
Well, self-medication is not advised anywhere in the world. The reason is because what you see, fever occur in thousands of diseases, if I don't want to say hundreds of diseases. Most diseases present with fever at one point or the other. So if you have fever, how do you know? So most times when you take analgesics, you take all these common analgesics, you are only suppressing symptoms, not treating the cause. So because of that, we always advise, no matter what the symptoms is, visit a healthcare facility, consult with the professionals, because the professionals can just look beyond that singular fever. They can attach some other risk factors. They will take detailed history. So, and from there, you will have the opportunity to run some of these tests if it is necessary, because the clinicians is at the discretion to say, oh, I'm suspecting this. This Chinese man that we are saying, nobody would have diagnosed COVID-19 if he did not visit a healthcare system. So our recommendation to the general public is we should find a way to use the available healthcare system. And luckily for us, the Ogun State system now have health insurance to make healthcare system affordable and accessible. So there are multiple models. Health insurance is there, our primary healthcare facilities are there. So these facilities are there that are affordable and accessible for us to use whenever we have any of these symptoms.
Okay, during COVID-19, one focal discussion was the issue of vaccine. And now the question is, should Nigerians still take vaccines or booster doses? As we have not been experiencing the prevalence of COVID-19 in Nigeria now.
Well, regarding booster doses, it is not for me to say. That will be something of a national guideline. It is not for an individual to say, okay, everybody should go and take it. You know, that decision will be made based on national need and based on assessment. But for anybody who has had the COVID-19, of course, the COVID-19 at least 2 doses. So it means that they've had the first one, they've had the booster dose. It means that they must have had some level of immunity. And aside that, because many people would have had COVID-19 at one point or the other, they would have also had some level of immunity. And that is what is explaining for why we are not seeing a lot of deaths in our community as a result of COVID-19, because we are going towards what we call herd immunity. We may not be there yet, but we are going towards it.
What's that herd immunity?
A significant proportion of Nigerians were vaccinated. Another significant proportion must have had a form of infection, either serious or subclinical infection. So because of that, it means that a significant proportion of Nigerians has had some level of immunity. It means that their body has developed some form of ability to fight it. That is so. Because of that, if a disease now enters that community, it's one of the explanation for why Cross River has not seen or confirmed another case. It's not that the case is not there, but the ability of the disease to spread has been limited, because as the disease is coming in contact with some people, the people it is coming in contact with has developed immunity. So the disease is not propagating. So that's what the basic definition of herd immunity I have just explained. So, but because Nigerians and most part of the world have developed some form of herd immunity because of the responses during COVID-19, which included vaccination. So that is explaining for why we are seeing subtle cases. It's not ravaging like wildfire like it came the first point. And that's another reason why we should not panic. But it does not mean we should let our guards down. Because as long as the virus is there, it can always mutate. You know, we've had different strains. We have had different strains and variants of COVID-19. Omicron, different. It's because the virus is changing some of its characteristics. So the virus still retains the ability to change some of its characteristics. So it means that it can still present tomorrow with some other characteristics that it never had. So it is based on that we are still heightening our level of surveillance and still watching out for it. And we are not just relegating it to, we are fine. Because we know that at any point in time, the virus can still throw surprises.
Okay, how are you managing this COVID-19 along other infectious diseases like Ebola in Ogun State?
Well, as I've said, it's about having systems in place. You know, most of those systems were not pre-COVID, or some were not there, some were not that developed. But we have learned from COVID-19 to develop most of these systems. So right now, as I've said, last week we had I will call it a scare, but it's, you know, in a public language. We have a suspected case of Lassa fever. A suspect. Within few minutes, it was picked in the facility. Within few minutes, the surveillance system, it goes to the state. Response was activated. The coordination meeting was held in less than an hour after the notification of all the key stakeholders. This is the situation, what next. So that coordination mechanism is there. And if we pick up any case, be it COVID-19, be it Ebola, be it Lassa, God forbid we are not praying for it, the same mechanism will be activated. So it's a mechanism that has been tested and tested over time. It's not perfect. Nobody has a perfect system. But that mechanism exists and we are still improving on it every day.
Okay. There are a lot of misinformation during COVID-19. What type, because we remember then, if you take salt solution, you prevent and all sorts of concoction then. what's the prevalence rate of misinformation in relation to COVID-19, especially as we had the announcement from Cross River?
Well, I can tell you that I will call that misinformation. And sometimes, misinformation may be malicious. It may be out of fear. When it is malicious, is some people, either because they have issues with the orthodox system, they don't want people to go there, or because for their personal gain, for political gain, for whatever gain. They just want to incite trouble and incite fear and incite chaos. So they could shun out a lot of misinformation. And we have learned lessons during COVID-19. And part of the lessons we have learned is what Cross River did. To prevent before the misinformation is circulated, they brought out the official information. So one of the ways to counter the misinformation is transparency and giving people the correct and authentic information. And that is why the commissioner had to come out and say, okay, we have this, this is the situation. As of that, when the whole public is already aware of the correct information, it's difficult for misinformation to fly. So it is one of the lessons we have learned about managing misinformation. And that's why this time around, you see me here on the radio. We don't have COVID-19 in Ogun State, but I'm already here and you are here. We are educating the public. It is part of the ways to manage misinformation, because we have to put out the authentic and correct information to the people. Once the people have the authentic information, the correct information, they have no reason to panic. So that regarding misinformation, I can tell you this time around, the level of misinformation is far lower than what it used to be in previous outbreaks.
What was the current dangerous myths circulating in relation to COVID-19? Because we always have these myths associated with COVID-19.
Myths?
That is misinformation.
Misinformation, okay.
That
if you do this, you will do this.
So
well, I will not be mentioning that, because if I'm doing that next, it's like I'm helping them to propagate the misinformation. So it is not for me to help to propagate a misinformation. What I am here to do is to propagate the correct information. So people may have all sorts of misconception or misinformation, but the correct information is that COVID-19 is caused by a virus. It is not Ishiaye. It is not caused by not spiritual. It is not caused because of sin. It is caused by a virus called COVID-19 that has different variants. That is the confirmed information. COVID-19 can be spread through airborne routes. It means in the air. If you are in crowded areas, through sneezing, people touching formite, and that is the correct information. COVID-19 is preventable. It has a vaccine. That is the correct information. COVID-19 is treatable. If you have it, you can be managed, isolated. The isolation is not because, some people attach some myth to it. It's not because you're a bad person or because we hate you. It's because we are trying to protect you and your loved one, so that you do not spread that infection to your loved ones. So that is the purpose of isolation when necessary. Because it's not in all cases that we need to. Sometimes we do self-isolation in the house if circumstances permit. It is on a case-by-case basis. So that is another correct information. It's not like when you go to the facility, we'll detain you automatically. It is on a case-by-case basis. Those who meet the criteria of house self-isolation at home, of course, they can stay in their house. They can work from home on their system. You understand? That is the correct information. So if people have had different things like you will be arrested, you will keep you, that is misinformation. So that's about treatment. So I've mentioned about the causative agent. I've mentioned about treatment. It is treatable. I've mentioned about how it is spread. It is not because of somebody hates you or they want to off or something. It's not that. I've mentioned about prevention. There are prevention mechanisms like vaccination. So these are the authentic information about COVID-19. And if you now have the COVID-19 by chance or by whatever reason, it is manageable. It is not a death sentence. So these are the authentic information we want to pass out to the public.
Are there specific hotspots or high-risk areas in Ogun State when it comes to this issue?
Well,
COVID-19.
Well, as I've said, this year we have not picked any case. But if you have to go through antecedents, go through disease dynamics. So if I'm mentioning certain areas, it's not because you have picked cases there or they have an outbreak there. It's just because they are probably more susceptible because of inherent risk. Crowded areas, any place that is overpopulated in Ogun State is at risk, because if somebody by chance brings the infection into that place, it may spread faster if they are not vaccinated. We also mentioned the role of vaccination. Our international borders, they are high risk area, because people move in, people move out. Now we have international airport, we have international land border at Idiroku and Ilara axis. So move any places where people travel routes is a hotspot. As you have said, Ogun State is also a gateway state, meaning that you cannot access Lagos from all the other 34 states or 34 plus federal capital. You cannot enter Lagos by land except you pass through Ogun State. There's no way. Or you go and pass through the sea. That's the alternative. So the fact that Ogun State is a transit hub makes us a high risk location. And that is why we have also strengthened our surveillance. We are aware of the risk. It is not by choice. We didn't put ourselves where we find ourselves. We are there. So it's part of the surveillance system and the preparedness plan. We do a risk assessment. So it's part of our risk assessment that let us understand that we have international borders, we have land borders, we are a transit hub where people come in and out, we are an industrialized area where people come in for businesses. The first case in Nigeria was picked here in Ogun State. It's somebody who came for business because of industry. So industry is an advantage. There are also challenges that come with some of those things. Expatriates come, different people come from all over the world. So we are aware. I'm saying all this because we have done our own risk assessment and we have identified this risk or possible hazard, and that's why we are putting mechanism in place such that we don't pray for it, but if it does, we'll be ready to respond.
You say there's no need for panic, but Nigerians and people of Ogun State want to hear from you one level of assurance and what they can do to ensure that they are safe when it comes to the issue of contracting COVID-19.
Well, you know that it's only God that can give somebody 100% assurance. So based on that, I will not put percentage to it. But I can tell you that within everything humanly possible, Ogun State have put mechanisms in place to protect the health of its citizens. So I've mentioned a lot of mechanism all day. Me being here, in fact, Ogun State, we have our own public health emergency operations center that is designated for public health events. So even when we have events that goes beyond Ministry of Health, it's a place we coordinate with other agencies. So the issue of Ministry of Environment doing their own we hold meetings routinely together. It's part of coordination, such that disease now we talk about One Health, and in One Health, the health of your environment has impact on your health as human being. So we cannot say we are in Ministry of Health, we want to protect the health of people without protecting the health of the environment. Because if the environment is dirty, you have cholera, you have diarrhea, you have all sorts of things. So we cannot be saying we are protecting health in Ministry of Health while neglecting a dirty environment. Our animals, dogs, they carry all sorts of diseases that we human beings can do, zoonotic infections. We have to work with the vets. So we have realized that, and it is part of the strong preparedness framework and response that we have a One Health mechanism in Ogun State, that all these agencies will meet routinely to assess risk from all these sectors. Oh, I may observe something from Ministry of Environment, I will give them information. So we share information. So the summary of what I'm saying is we have a robust coordination framework mechanism that has been tested and that we are still using in Ogun State. So based on that, diseases, you cannot always predict it 100%. Sometimes they shun out surprises. So of course there are still possibility for surprises for different types of diseases, but when it comes, we have mechanism that can easily adapt, a flexible mechanism that can adapt. So we learn on a day-by-day basis, not just from our own experiences, we learn from other people's experiences, what happened in other states, what happened nationally, what happened worldwide. So we are constantly developing and adjusting our mechanism to prepare for global events.
Okay, I think I like the part you talked about, the symbiosis, the coordination, the collaboration, the synergy. Again, we need to reassure the people, because the essence of this conversation is to give some reassurance that you're safe, and you'll be safer if you take the precautionary measures and you're preventive. How then can we improve the federal and state coordination? You have talked more about the state being ready, being proactive and all. The states and the federal, they work hand in hand. The coordination among them, look at what they put in place. Services are demanded, at the state level, federal level. We move from Ogun to Lagos, and the federal might comes to here and all those. So how do we promote this key national issue around the federal state government coordination?
Well, I will tell you that Ogun State is not doing this in isolation. That is a fact. The surveillance, emergency preparedness and response system is a well-structured system, and the structure starts from the community. And I will just give you an overview of how our surveillance system and response system work generally, not just in Ogun State now, because you're talking about how it links to national. At the community, we have people we call community informants, who, we pick something. Even our patent medicine vendors, yes, they give us information. Somebody selling drug, okay, they have what we call case definitions.